If you've been told that you no longer have enough bone for an implant, or you've started noticing your gums receding and your teeth looking longer, it can feel frustrating and confusing. Many people assume this is simply a natural part of aging, but that's not always true. In reality, there is a silent process happening beneath the surface bone loss, and very few people realize how quickly it can occur. This is exactly what happened to a patient we'll call Carmen. At 66, she had a tooth extracted, and since it wasn't visible when she smiled, she thought she could delay the implant. But what she didn't know was that while she waited, her jawbone had already begun to break down from the inside. That's why it's so important to understand what's really happening, because this issue affects anyone who has lost a tooth or is planning dental treatment. The reason the jawbone disappears after losing a tooth is often misunderstood. Many people think of bone as something permanent and unchanging, like cement in a building. But bone is actually living tissue that constantly adapts to how it's used. A simple way to understand this is to think about a professional tennis player who has their arm in a cast for months. When the cast is removed, the muscle is weaker, but even the bone has lost density. It's not because it's diseased, but because it hasn't been used. The same principle applies to your jawbone. Every time you chew, your tooth root sends small signals to the bone, telling your body that this area is still needed and should be maintained. However, when a tooth is extracted, those signals disappear completely. The body then makes a silent decision. If the bone is no longer necessary, it begins to reduce it. This process is known as alveolar bone resorption. The bone doesn't break or get infected, it simply shrinks little by little because it's no longer being used. There is also an important detail that often confuses patients. Some people wonder if a tooth that has had its nerve removed still plays a role. The answer is yes, it does. Even without a nerve, the root is still present, and it continues to transmit chewing forces to the bone. The bone doesn't care whether the nerve is alive or not. It only responds to the physical signals it receives. The real problem begins when the tooth is completely removed, because that's when those signals stop entirely and bone loss accelerates. To understand how quickly this process happens, let's return to Carmen's case. After her tooth was extracted, everything seemed fine on the surface. The wound healed well. There was no pain and no obvious issues. But internally, her bone had already started to shrink. It's similar to scaffolding at a construction site once the work is finished, and no one needs it anymore. It begins to be dismantled piece by piece. This is exactly what was happening to her jawbone while she continued with her daily life. When she returned 8 months later for an implant, a 3D scan revealed significant bone loss. Scientific evidence shows that most of this reduction happens within the first 3 to 4 months after extraction. For example, a ridge that was originally 8 millimeters wide can shrink to just 4 or 5 millimeters in less than 4 months. In Carmen's case, the implant was still possible, but it required additional bone regeneration procedures, which meant more time, higher cost, and greater complexity. A common question many patients ask is whether a removable denture can help protect the bone if they delay an implant. While it's true that a denture fills the visible gap, it does not solve the underlying problem. A removable denture rests on the gums rather than the bone, so it does not provide the stimulation needed to maintain bone strength. As a result, the bone continues to shrink silently underneath. This is why waiting, even for valid reasons, can make future treatment much more difficult. The bone does not pause or adjust based on personal circumstances. It simply follows its natural process. Another important point to understand is that tooth loss is not the only cause of bone loss. There are also hidden threats that can damage the bone even when the teeth are still present. The most common of these is periodontitis or gum disease. It can be compared to a house that looks perfect on the outside but has a foundation being eaten away from within. When bacteria accumulate beneath the gum line and are not removed, they cause chronic inflammation. This disrupts the balance between the cells that build bone and those that break it down. Over time, the bone begins to deteriorate, and the teeth may loosen, not because the teeth themselves are weak, but because their support structure is being destroyed. One of the earliest and most visible warning signs is bleeding while brushing. This is not normal and should never be ignored, as it indicates inflammation that requires professional attention. By the way, if you are taking anticoagulants such as acetoacetamide, Sintram, or similar medications, it is important to understand that your gums should not be bleeding excessively every day. Many people assume bleeding is simply due to brushing too hard, but that is not always the case. Persistent bleeding is often a sign that something deeper needs to be evaluated, and it's essential to have it checked by a professional rather than ignoring it. The second major threat to your bone is smoking. To understand its effect, imagine a garden with a drip irrigation system made up of very thin tubes that deliver water directly to the plants. Now imagine those tubes being slowly crushed one by one. The water may still be flowing, but it no longer reaches the plants effectively. This is exactly what nicotine does inside your body. It reduces blood flow in the tiny vessels that supply your gums and jawbone. Without proper blood circulation, healing becomes slower, weaker, and less effective. The scientific evidence is very clear on this. Smoking is strongly associated with a higher risk of implant failure. In fact, some studies show that the risk can double or even increase further depending on the situation. This is not just a statistic, it can be the difference between an implant that lasts for decades and one that fails within a short period. The third threat is poorly controlled diabetes. This condition affects the body in a similar, but even more subtle way. When blood sugar levels remain high over time, they begin to damage the smallest blood vessels in the body, including those responsible for delivering oxygen and nutrients to the gums and bone. As a result, healing is compromised, and the gums become more vulnerable to bacterial infections like periodontitis. What makes this particularly concerning is that the relationship works in both directions. Poorly controlled diabetes can worsen gum disease, and gum disease can make it more difficult to control blood sugar levels. However, this situation changes significantly when diabetes is well managed. Patients with good glycemic control can have outcomes similar to those without diabetes. The key factor is not the presence of diabetes itself, but how well it is controlled. These three threats, gum disease, smoking, and uncontrolled diabetes, often interact with each other and silently accelerate bone loss. The good news is that they can be managed, and there are practical steps you can take starting today, depending on your situation. The first solution is to preserve the bone at the time of tooth extraction, a process known as alveolar ridge preservation. Think back to the example of scaffolding at a construction site. Once it is no longer needed, it begins to be dismantled. In dentistry, we can slow this process by placing a special biomaterial into the socket immediately after the tooth is removed. This material acts as a temporary scaffold, giving your body the structure it needs to gradually form new bone, while it does not completely stop bone loss. It significantly reduces it and improves the chances of placing an implant later without complex procedures. If you are planning an extraction, it is crucial to discuss this option with your dentist before leaving the chair, not afterward. The second solution focuses on addressing gum disease by treating the root cause rather than just the symptoms. If your gums bleed or have receded, the issue is not on the surface. As mentioned earlier, it is like having termites in the foundation of a house painting. The exterior will not fix the underlying damage. The standard treatment for periodontitis is a procedure called scaling and root planing. This involves a deep cleaning of the tooth roots beneath the gum line, where regular brushing cannot reach. By removing the accumulated bacteria and deposits, inflammation is reduced, and the progression of bone loss can be stopped or significantly slowed. What does this treatment actually involve? It focuses on removing the bacteria that have built up around the root of the tooth, especially below the gum line, an area your toothbrush simply cannot reach. This procedure is done under anesthesia, so you won't feel pain, but it requires precision and careful work. The goal is to thoroughly clean the infected areas so that the bacterial load is reduced or eliminated. Once that happens, the inflammation begins to settle down and the condition stabilizes. In most cases, the gum tissue doesn't fully regenerate on its own. But for many patients, this treatment is enough to stop further damage and make them suitable for the next phase of care. More advanced situations, where the damage is more severe, a specialist may recommend additional treatments depending on how much bone has already been affected. The third and final solution is to restore the natural load to the bone. This usually involves placing a dental implant, or in some cases, performing guided bone regeneration first, if you have missing teeth that haven't been replaced. Remember the earlier example of the tennis player bone? Needs stimulation to stay strong? Okay, dental implant is the most effective way to restore that stimulation because it functions like a natural tooth root, transmitting forces to the bone when you chew. Unlike removable dentures, which only sit on the gums and do not provide this essential load, implants actively help maintain bone structure. Many people worry because they've heard of someone whose implant failed. While complications can occur, they are often linked to specific issues such as insufficient bone, ongoing infection, smoking, or poorly controlled diabetes. When the conditions are properly managed and the bone is adequately prepared, long-term success rates for implants are very high. The outcome depends greatly on the patient's overall health and how well these risk factors are controlled. Even if significant bone loss has already occurred, it doesn't mean all options are gone. There are advanced techniques such as guided bone regeneration that can rebuild the lost bone before placing an implant. These procedures require more time and careful planning, but they are well supported by scientific evidence and offer a reliable path forward for many patients. It's also important to mention a key consideration before undergoing any oral surgery. Certain medications, particularly those used to treat bone conditions, can influence how dental procedures are managed. Drugs like bisphosphonates, such as alendronate, or resedronate tan medications like denosumab, can affect bone healing. If you are taking these medications, it is essential to inform your dentist before any procedure. In most cases, especially with oral medications for osteoporosis, the risk is low, but it still needs to be considered when planning treatment. However, if these medications are being administered intravenously, particularly in patients with cancer, the risk is higher, and coordination between your dentist and oncologist becomes necessary. Most importantly, you should never stop these medications on your own out of fear, as doing so could lead to serious complications like fractures, which are often far more dangerous than the dental risks involved. Now, why does all of this matter more than you might think? Let's go back to Carmen. After understanding what had happened, her first question was likely the same one you're asking yourself right now. What should I do next? The answer begins with identifying your current situation. If you have a tooth that needs to be extracted, speak with your dentist about preserving the bone at the time of extraction. If your gums are bleeding or have receded noticeably, don't delay. Schedule a professional evaluation as soon as possible. And if you've been living with missing teeth for a while, it's important to assess your condition and explore your options before further bone loss occurs. The golden rule in oral health is simple. Prevention today saves you from more complex treatments tomorrow. The bone you protect now is bone you won't have to rebuild later. Once bone is lost, restoring it requires more time, more effort, and greater expense than preserving it in the first place. Looking ahead, there's also an exciting reason to care about your bone health today. Early-stage research, particularly in places like Japan, is exploring the possibility of stimulating natural tooth growth through targeted therapies. While this is still in the experimental phase and not yet available in everyday clinical practice, the concept is promising. However, even if such treatments become widely available in the future, they will depend on one critical factor: a healthy foundation of bone and gums. Just like a seed cannot grow in asphalt, new solutions cannot succeed without the right biological environment. So if you want to stay informed about these future developments and understand how they might impact you, keep learning and stay proactive. Take care of your oral health today, because it will determine the options you have tomorrow.